Hello, friends. It's time for another policy briefing. We wish it wasn't so, but we're here to talk once again about what's happening across the United States, and in particular states, in regards to the response to COVID-19. This is number 5 of the COVID Chronicles, and there's also a whole series of programs that you can listen to from our free phone app at thepublicsquare.com. The COVID Chronicles there. I think we've probably got now, 15 hours or so or more of programming as we've all been through this situation together. The reason we wanted to do a policy briefing tonight is not because we're trying to keep up some base of support. We really do wish this issue would go away so we could get back to doing things that we would normally be doing in a major election year. We're still trying to do all those things, including building the American Mission Center. I was there tonight just before we got started, and the walls are going up, and next week the roof is going up. And so soon, when we do a briefing like this, we'll all be sitting together in the same room and being able to broadcast both to you in your living room and again around the world in regards to what's going on in American public policy. We have many new guests on our program tonight, and I would like to welcome all of you and glad that you're here. We're glad that you're joining us. In case you're wondering, what is this thing called the American Policy Roundtable? We've been around for 40 years. People call us missionaries to America. Our mission statement is really pretty simple. We teach America every day. That's what we do. And our focus is on the principles that are behind our Declaration and our Constitution, those principles upon which those documents stand. And so we talk about those all the time. It just so happens that healthcare policy is really in our wheelhouse. It's been something we've been working on a regular basis since 1994. So when we get to the questions of quarantines and lockdowns and free enterprise and religious liberty and all the things that COVID has really been like a shining light upon the foundations of our country and our decision making and where we are as a culture, well, this stuff is all the stuff that we've been dealing with for 40 years. So we want to talk today particularly, and here's the basic premise. We want to give you some of the background as to how we got into the mess that we're in with a number of the strategies that these governors seem to be doing across the country. And you'll notice it doesn't matter whether they're Democrats or Republicans. They're still making choices that are having tremendous negative impact upon our personal liberties, our civil liberties, and our economy. And they seem to be all working off of a lot of the same talking points. So we want to do a little bit of background work on where these things have come from. But then we also want to specifically talk about where they're going and the attempt to keep the economy shut down, or maybe even bring us to a position where we're shutting down more of our institutions. And in essence, the power brokers are clawing back the liberties that people are trying to reestablish. Now, one thing we're not going to talk about in great detail tonight is how all of this plays into the presidential election, because at this stage in the game, we're not sure yet. It's too soon to know. The issues that truly will shape the decision-making on this election will happen after the convention. So we're not going to know these things until August. So we've got some more time, and it may even be till September. Well, this election will be on a short field. So what will the impact of COVID-19 be at that stage in the game? Well, this much we can tell you for certain. There are decisions being made right now that are going to bear tremendous impact on our culture in September and October. So COVID will be one of the big issues and the miseries that have been caused by COVID. We'll get into some of that tonight. But we're not going to get into the great details about who's trying to manipulate this and that to get this person elected or that person defeated. Not because we're afraid to talk about that, or not because we don't think it matters. It does, but it's a little early. We'll get to that yet. Right now, we want to talk about how we got in this mess, and maybe how we can unplug some of the energy among the political panic mongers if we can understand more clearly where their logic comes from. So joining me today, and for the balance of this evening's presentation, our National Legislative Director, Melanie Elsey, and Rob Walgate, Vice President of the American Policy Roundtable. Both of these wonderful friends are guests, our regular panelists on the Public Square. And just, you won't see him on screen, but behind the screen is that fellow that you know as Alan C. Duncan, who's doing our production for this evening. So, Rob, they're supposed to text questions to your phone number, right? So if they actually join in tonight, They get your cell number?
Well, that, or they can email them to support@thepublicsquare.com.
Oh, that's a better way to go. Support at thepublicsquare.com, where other staff members are waiting nearby to fire those emails over to you.
And I get those as well, so I will see them. But there's been a few that have already come in.
All right. Melanie, thanks for joining us as well this evening. And I think I'd like to start with you, just because you're the new person to this format and people have been wanting to hear you. If you could tell us 1, 2, or 3 of the things right now that bother you the most that are happening in the States in regards to COVID-19, why don't you just take it for a few minutes?
Well, probably what's bothering me the most is the overreach of the executive branch through executive orders or through their state departments of health in issuing very punitive orders in the name of public safety. And the fact that there's a disconnect between public safety and honesty in reporting. And we can get into that if necessary throughout this discussion, but the numbers that are being reported, the almost impossibility of tracking the accuracy of those numbers, specifically because early April, the CDC changed its guidance on counting cases to include probable cases. And that opens up a whole nother aspect of overreach because it provides a rationale that's not real.
Let me stop you and ask this question, if I'm hearing you right, and our listeners as well. We all know that the media is brought all the numbers back. The idea that now we're keeping score again, it's like a perpetual game of bingo on the screen. It never, ever ends. And they want us to believe that this pandemic is now completely out of control. And you're questioning the way they're doing the count.
Absolutely. Because in counting the cases, they're including confirmed cases through the actual testing with the cotton swab. They're including cases that are individuals who have the antibodies through the serology tests that are given, and that's whether it's an IgG or an IgM. Whether you've had the COVID in the past and you no longer have an active case, they're still counting those as cases, and you can be counted as a case as a probable case, which lumps you into the actual cases if you've been in contact with someone who's been confirmed. So there are.
No, hold on. You got to give us the example of that one. I know you've got it. I don't. Melanie shared this with us in staff on Monday, and it blew us away. This is the example from Texas, right?
Well, it's an example from Texas because they are most completely implementing the CDC's recommendations. The CDC pushed this revised definition to include probable cases out to the states in early April. April 5th is when they approved it. So the state departments of health have been implementing this morphed definition for cases since at least early April. Some of them, jumped in mid-April, but it's been a couple months now or more that they've been using these in their case counts. And so for example, you have to meet one clinical criteria or one epidemiological link, which would be if I've come into contact with someone who's had COVID, or a serology test that determines that I've had the antibodies, whether it be past and the disease has been cleared for months, or if I have an active case and the antibodies are in process of being produced. So you have to meet two of a combination of those. So, for example, in Texas, where they have a statewide endemic right now, where they're panicking because their case numbers are jumping, which I don't think is real, but that's just my opinion. But anyway, the state is determined to be an endemic. So if you are in an endemic area, so for Texas, it's the whole state. So you've already met one of the two. So to then meet another clinical criteria, you have to have a symptom, but not necessarily be tested. So if I have a fever, a cough, any of those types of symptoms, I could have something else and not be COVID, but they're still going to put me into the count. So
Well, they're going to put you into I'm sorry, they're going to put you into the COVID count?
Yes.
Just because you exhibit a flu-like symptom.
Yes. I'm not extrapolating my understanding of this. This is exactly what was discussed not too long ago, mid-May, May 18th, I think, was a commissioner courts meeting in Collin County, Texas. That's on video. That's available to the public. Anyone can watch their discussion of how that county now is rolling off of their own dashboard count and handing it off to the state because of these expanded definitions of case counts. And the county will no longer have a control over when they do their contact tracing. The contact tracing now has to be expanded out to the probable cases. If a probable case comes in contact with another person, that person becomes a probable case. And so you're breaking up the direct linkage between someone who's actually been diagnosed with an actual test.
Thank you. Thank you very much. I know that was a long way around, and you've got drawings or actual documents that show the graphs and the pictures and the links of how they're establishing this, that all prove the reality that in at least the state of Texas, based upon CDC and federal guidelines now, you can be part of the COVID count for simply exhibiting a symptom without any form of testing whatsoever. Right. Now, when you see these cases jumping and you realize that they've changed the vote count, I want to ask you, friends, where has anyone shared that information with you? We watch, all of us monitor media. Rob, Melanie, have you seen anyone talking about this in the press?
No, and to put an exclamation mark on it, the hypothetical that they gave in the meeting that's on print, on paper, they took one diagnosed case and turned it into 17 for the COVID count.
Wow. So one of the first concerns we have with both the federal level and the states is they're cooking the books, the numbers. Now, of course, that quickly causes you to ask the question, why? And we're not going to get to the why question yet. I mean, there's a bunch of answers that jump out, but let's let the why question go for just a second. Rob, let's go to you for just a minute, if we could. And you've been all over radio all over the media today. And in specific, you've been talking about what's happening in the state of Ohio, where Governor DeWine seems to be wanting to claw that state back into a crisis that will create a lockdown. Now, just as a matter of understanding, and I'm going to sound a bit critical, please understand when we talk about Mike DeWine, when Mike DeWine decided to get into statewide politics, we were in the room where that happened. We've known Mike DeWine for a long time. Mike and Fran DeWine would be excellent neighbors for anyone who had the privilege to have them live next to you. You'd love them in your neighborhood. No one's attempting to condemn any of the political figures we're talking about here today. But that doesn't mean that they don't make mistakes, or that they could carry ideas around that really need to be reproved, or that they could get themselves in a position where they would paint themselves into a corner and be unable to get out. Now, it appears that Mike DeWine has been systematically doing that since at least March of this year. And now, after sort of ending the lockdown in Ohio, the governor, I don't know, he got a new set of crayons or a new set of magic markers or something, because now he's gone color crazy. Okay. He's got a chart set up that starts, it goes yellow, orange, red, purple. He's got these colors, and there are parameters of what's happening in each of Ohio's 88 counties. And if X, Y, and Z is happening, you're orange, and then if you add 3 more elements, then you're yellow, and then you get to red, then you get to purple. By the time you get to purple, you're locked down again.
Yes.
In other words, he's clawing the state back into a lockdown by processes, and it all begins with this rising case count. And Melanie, you've already discredited the way numbers are being counted, but it starts with that. So, Rob, let's talk about the color code and all the crazy things going on in Ohio and the counties.
Well, in the color code, right before you get to purple, which is total lockdown, there's red. And that's what the governor did a few days ago, is he issued red for 7 counties. And what that means is you will be forced to wear a mask when outside of your home, even if you're outside and you can't social distance within 6 feet or outside of 6 feet with someone. So he did that in 7 counties. But the interesting thing about the criteria is when you look at the 7 criteria items, it's set up, in my opinion, that all 88 counties are going to move at some point into the red, the color red. And the reason for that is we can look at Huron County in the state of Ohio. It has 58,000 people. It has had 2 deaths since March 16th.
I'm sorry, two deaths?
2.
Okay.
It has had 28 hospitalizations since March 16th. 28 hospitalizations. Yet that is a county that became red and was forced to wear a mask anywhere indoors and outside if you're within 6 feet of someone, based on the criteria that the governor put forth in his most recent health order. So if a county such as that can be forced red, they're looking at all 88 counties and doing what they can to bring them in tight.
Now, these COVID parameters that are set up that lock into the color codes that sort of fill in the coloring book on all of this, they're highly subjective on top of that. It's not like someone came down from a mountain with the 10 COVID commandments and said, these are the things that will lead you to imminent death. Therefore, if you get to 10, you're all going to die. So this is what you got to do. These things are highly subjective. In fact, they're so subjective that the governor took Huron County red 3 days ago, and today they dropped back to yellow. So it was masks on, masks off, masks on, masks off. It's back and forth. And you wonder why people are just saying, I give up. I just don't get it anymore.
Well, and also with the number of cases, as Melanie highlighted, they can manipulate the number based on probables. We also have questions out regarding manipulation of the numbers in regards to if one person has multiple positive tests. That because many employers, or a number of employers, require 2 negative tests for an employee to return back to work. So if one individual has 6 positive tests, those positives, each positive must be reported to the local health department. Those go into the numbers as well.
Well, let's take a minute and talk about Tennessee, which has sort of been the one that's been driving me crazy for the last week. Tennessee, in particular, let's talk about Williamson County, Tennessee. Now, many of you know that we have an office in Williamson County in the city of Franklin, and we've been there for over 10 years now building, as we have had an office since 2007 or 7, I believe, in Central Florida, which is a whole nother story. But the Williamson County is viewed as the most conservative county in the state of Tennessee. Williamson County is where the governor, Bill Lee, who's also supposed to be a conservative, also lives. And recently, Governor Lee, through executive order, not through an act of the legislature, not through an act of law in the state of Tennessee, but based upon a very shaky extension of a declaration of emergency powers, decided to delegate to the counties the ability to mandate masks at all time, and to assess civil and criminal penalties as well if you don't wear a mask. Well, the mayor of Williamson County and 6 of the city mayors inside that county decided to go with a mandatory mask law, not via a vote of the legislature of the people. They just decided. The governor issued an edict, they issued an edict, and in that edict, they decided that, and some of them may have actually had votes in their city council, but in essence, these were edict votes based on the edict, and it came down, or decisions, and it came down to this: if you're outside your house in Williamson County, you're not wearing a mask, you got a Class A misdemeanor, which means you can go to jail for a year and be fined $2,500. Now, like Huron County, there are not a lot of hospitalizations, not a lot of deaths in Williamson County. Why would people do that? We've called it masked anxiety. Others have called it masked hysteria. Let's talk for a minute about masks. We have a legislative alert that's coming out that will be a part of tonight's show notes. And you'll get an email if you're on our regular monthly update email list. If you're on our mailing list, we'll send you this legislative alert automatically. And you'll see in there a series of comments about masks and a series of articles. One article is from doctors who are writing in the New England Journal of Medicine. Another is, the other comment is an accumulation of research in a number of other publications, one of which includes the Lancet publication, Lancet. These are the two upper crust medical journals in the United States of America. A lot of docs will tell you that that's where all the upper crust insiders of medicine do their reporting in these publications. Well, in the New England Journal of Medicine, a report came out recently, which the doctors who wrote it in the month of earlier in April, in June, tried to recant because people caught on to them. The essence of their article was, scientifically, masks as a means of preventing COVID are inconclusive at best. They stressed in the article they were frustrated because they couldn't get their colleagues to listen to them. But they were also quite open in saying that the power of masks really has more to do with limiting the transmission of anxiety than it does a virus. Now, these were medical insiders in the prestigious publication, the New England Journal of Medicine, saying they're not very effective, but they make people feel better.
Dave,
and you can study a vast number of other journals as well and studies to come up with, at best, masks are inconclusive. So the point being that these mayors and governors are jumping on a mechanism that the medical community is far from universally agreeing solve any problems, especially when we get to the level of masking that you see out there in the general public, which is about the same as using a piece of paper towel and duct tape to put over your face. Go ahead, Melanie.
Earlier this week, my daughter took our 4-month-old grandson to the emergency room. For medical privacy, I won't describe what the issue was, but I will say that she was told prior to driving him in, because my son-in-law is a fireman, he was on his 24-hour shift, so Rachel was the one who took him in. She was told she would have to wear a mask, so she took a mask with her. She gets to the ER doors and she's walking in with the baby, and she's instructed at the door that she can't come in with her mask. They required her to take off her mask, and they issued her a hospital-grade mask because they told her the cloth masks don't work. So she wasn't even allowed to wear a mask of her own in the ER of the children's hospital because it was ineffective.
Now, let me be careful here, because it would be wrong to jump to the conclusion that this battle should now be one of masks versus no masks, or cloth versus surgical or hospital grade. No, the point is simply this. The masks by politicians are being used as tools. Mm-hmm. Now, what's the purpose? To make you feel better, to make you feel less afraid, to make it look like we are all in this together? Because I want to tell you something. I'm not in this with them. I can't find any evidence that is truly overwhelmingly certain that in general application these masks work very well at all. And the docs we're talking to, they're simply not buying it. They're simply, but see, they're afraid to say so out loud because the politicians and the media punish anybody who dares to be contrarian. Now, I don't know how you feel about being herded around and you can't ask an honest question, you can't get an honest answer. Now, I also want to say quite quickly that if you've got a newborn child coming into your household, into your family, of course you should wear a mask. No, don't be dumb. Or if you're visiting someone that's elderly with comorbidities, of course you should wear a mask. And here's another thing. If you want to wear a mask, wear a mask. Nobody's judging you. No, I have to tell you.
Well, there are some people that are judging people.
Well, I went out to lunch. We're certainly not. I went out to lunch today, and there was an older group of guys that decided to have lunch together at a restaurant. And I thought that's kind of cool. So they came in with their masks, and it's fine, no problem. But I have to laugh because like the second guy that showed up, he had his mask and it was so he sits down at the restaurant and he takes off his mask, and that's great. He takes off his hat. He's got a ball cap on, and he throws the ball cap on the floor and leaves it under his chair the whole time he's eating. And I'm thinking to myself, and those same hands that pick up the hat that's been on the floor in a restaurant that hasn't been cleaned for hours is then going to put the mask back on his face and think that he's safe and he's keeping everybody else safe. I mean, we've lost common sense on this. Now, it would be funny, it would be sad, it would be leave it alone. It's just a symptom. It'll go away. A year from now, we'll laugh at this. But the governors in Tennessee and Ohio are saying you're going to go to jail if you don't wear a mask, or you're going to be fined if you don't wear a mask. Now think about what they're doing in Ohio. You've got a county as big as Hamilton County, where Cincinnati is, or as big as Franklin County. And Franklin County and the city of Columbus are vast. I mean, you could go from the south end of Columbus the whole way out to Wexner World out in New Albany, and you're covering, golly, at least 50 miles. And the difference between agricultural urban and more agricultural suburban, the difference in that vast territory and the number of people, and to treat that entire county as everybody has to wear a mask. There's probably communities in Franklin County where there's not more than one case, if any. Now they all have to wear masks. So you see how arbitrary this is? Now, it'd be okay if it was an argument among people saying, you get to do it, you don't want to, you don't have to, it's voluntary, but it's a mandate. It's not a mandate by our legislature. It's not a mandate by city council voting. It's a mandate that flows from executive orders based on emergency powers. And guess what? The emergency that they told us was going to happen at the beginning has never happened. So how can you have emergency powers on an emergency that they're still saying is coming? From a purpose of law. Go ahead.
And how can you mandate health measures on healthy people? The powers that were given to departments of health in endemics or pandemics or a leakage of a poisonous gas or something was to be restricted to the people that it affected or the people who were tested and had the contagion. We've never in our history, ever, and across the country, had this type of mandate on healthy people. The shutdowns, the mask wearing, and I get that they say that if you can be asymptomatic and still have the virus, I'm not convinced. I'm convinced asymptomatic people can have received the virus if they test positive and they have no symptoms. I'm not convinced that they transmit it without symptoms. If they're not coughing, I'm just not convinced that someone without symptoms can easily pass the virus on to someone else just by being next to them.
Well, there's a lot of doctors that agree with you. Go ahead, Ron.
And that's one thing we've talked about is we've seen the numbers grow all over the country. That's because we're testing everyone, whether they have symptoms or not. We're just mass testing. And when you test every single individual, someone made the comment that this is the only virus where you need a test to find out if you have it because you don't have any symptoms of it, but they're going to test you just to find out if you have it anyway.
Well, let's go now into the underpinning of all of this. And I would like to sort of tell us all a story, if you don't mind, because it came to me recently. We'll go back to the example of Ohio. As I mentioned earlier, we've all known Mike DeWine for quite a while. And if any of his associates or employees or friends are listening, tell the governor we say hello. The same thing with Governor Lee or Governor DeSantis. Those of you that are listening in Florida or anywhere in Illinois. If you're listening in Illinois, don't bother telling Governor Pritzker we say hello because he's not going to. It won't matter anyhow. But the point is, we pray for all these people, and they are not our enemies. We disagree with the policies, but that's a different thing. That's what we're supposed to do. We're supposed to all be in this together in the sense of for the good of the country. And that means sometimes we're going to disagree, and we're supposed to argue these things out respectfully. But let me go back and tell you a story about Governor DeWine. We ran into a newspaper article that we had missed. It came out back in March from a newspaper called the Xenia Gazette. Many of you still remember the town of Xenia from the tremendous tornadoes that they experienced many years ago. Some of the worst that the Midwest has ever seen. Xenia is a little town, and the Gazette's a little newspaper. And Mike DeWine comes from outside Cedarville, was owned a farm, lived on a farm for most of his life. Fine people. Xenia Gazette's a little paper. It's connected to a couple of other little papers, and they have an award-winning journalist who's in their executive department as well, who had a chance to interview Mike DeWine back in March at his home. It was a private interview, and in that interview, Mike DeWine was talking about how he came to his decision-making processes in regards to how he was going to deal with COVID-19. And in that interview, Mike DeWine referred to a book. This is the book, The Great Influenza, the story of the deadliest pandemic in history, written by John M. Barrie. Now, John M. Barrie is a novelist and a historical novelist, and he did a very good job writing this book. He is not a physician, nor an attorney, nor an expert in public policy. He's a good writer and an award-winning writer, and he wrote a book about 1918, the Spanish flu. Mike DeWine said this was the book that he determined would serve as his outline for how he would deal with these decisions. And then he very specifically pointed out an event that happened in September of 1918, in which the Liberty Fund parades were supposed to be happening in both Philadelphia and in St. Louis. The Liberty Fund was the war savings bond sort of thing, and it was to support the World War I in 1918. Well, Philadelphia decided to have their parade in spite of the fact that this new flu that was infecting many of the American troops was now beginning to infect the general population. And Philadelphia decided they would have their parade anyhow, even though there were people getting very, very sick and people were getting concerned. They had a giant parade for the Liberty Fund. And shortly thereafter, 12,000 people were infected with the Spanish flu. Many died. St. Louis chose at the same time to cancel their event, and only 700 people were affected by the Spanish flu. This was the example that Mike DeWine cited in this interview, in which he said that the people who had built the models for him, the experts that he was looking to for help, made it clear to him that in a pandemic, there are moments of windows of opportunity where very aggressive decisions must be made. And if that window of opportunity is lost, it will never come back again and have terrible consequences. The point of that March interview, there are many points to it, not the least of which Mike DeWine set the course of his policy, and his policy has been heralded by major media outlets across the country as the best example of how to go about this, is built on a model from 100 years ago. And the success of Mike DeWine's leadership based on that model missed the mark by about 100 years. And here's why. COVID-19 is not the Spanish flu. This is the first responsibility of leadership that every governor has, is to determine what is the real threat in this emergency. Now, nobody likes COVID-19. People have died from COVID-19, and that's very sad and very tragic. And all of us should care about what we can do to stop further deaths from happening. But there was enough experience in the world by the middle of March that when Mike DeWine made the decision to go this way, he could have readily looked around the world at the statistics and seen that COVID-19 was primarily impacting older people with comorbidities, not younger people, by far. Now, everyone's saying now, oh, but it's getting to the young population. We'll get to that in just a second. The grave risk of death, not infection, death, is in the older population and people with comorbidities, chronic diseases that convert to fatalities. There's the risk. But instead of focusing on that model, What Mike DeWine did, and Bill Lee has done, and many other governors have done across the country, is to say what we must do as good public policy is prevent people from getting sick.
Yes.
Okay? Rob, what's wrong with that theory to prevent people from getting sick?
When we look back to middle of March, when all this talk was happening around the country, the goal was to isolate people, even though they isolated and quarantined millions and millions of healthy people, because they said they didn't want to overwhelm hospitals. We may run out of ICU beds. We may need ventilators. Well, we've seen it come to fruition. We haven't run out of ICU beds. We never came close to using all the ventilators we had access to. And now studies tell us that the ventilators probably aren't as good as they once believed they were in combating this virus. But now all that's changed. We know we're not going to overwhelm hospitals. The goal now seems to be no one can get sick ever again. That's the goal.
No, Melanie, because in your studies, do you think it's possible to outrun a virus? Can you hide from it?
No, you can't outrun a virus. No.
All right, Rob, no. Can you outrun a virus? You're pretty quick, Rob. Can you get past it?
No, you can't outrun it. And also, we found out even if you lock yourself in your house, if you think it's just going to disappear and go away, it's still going to be out there.
Let's think about it. If everything we've done so far, we still can't escape the thing, can we? Now, what Chuck McGowan told us back in week 1 of the COVID Chronicles is there are 3 ways human beings interact with viruses. The first is you get sick, you get better, you have antibodies. The second is you come up with a vaccine, which is a form of an antibody process that's artificially brought into the human experience to give you the advance against the virus. And the third is that you die. You get it and you die. Nothing has changed. In all of this activity and all of these billions and trillions of dollars that have been spent, no one's come up with a 4th option. We already know that the death rate for COVID-19 is very low, especially if you don't have comorbidities and are quite elderly as well. Very low. So why are they panicked about the fact that the virus is now moving through the general population? Because without a vaccine, it is impossible to stop the virus from moving through the general population. I said it. I said impossible to stop it. See, this is something they can't accept. Melanie, go ahead, and then I want to pull something out of this book.
Well, do you think that there's also a possibility that such extreme conditions were predicted early on that we never hit? You know, we were going to get 10,000 new cases a day, per day, 10,000 per day by mid-April. That never came. It's almost as if they now have to justify past decisions and elongate the extension of these orders in order to say, well, we're still in danger. We're still in danger. It's kind of like Chicken Little, you know, the sky is falling, but the sky just never falls. Not that we don't have some need to be careful, like you said, with the vulnerable populations, but you know, I fit some of the comorbidities, but I'm not concerned. I'm just not concerned.
Let me come back to John M. Barry's book and read from pages 456 and 457. Now, why are we reading about this book? Because this was the model that Mike DeWine, the premier vanguard of the strategies among the governors, this is the book he said he based his decisions on. Oh, and lest we forget, the day after the Xenia Gazette published the DeWine article, which we'll have up on our show notes, you can read that article after today's briefing. The day after that article was published was the day that Johns Hopkins University put out on a webinar their chief virologist statement that said that COVID-19 is a mild disease with mild symptoms for most people. He said it 4 times on that video in different ways, but trying to explain that while this disease has deadly consequences for a percentage of the population, no one is denying that or diminishing it. In regards to the vast majority of people, since we don't have a vaccine, we should not be in a state of panic. Now, the influenza of 1918 was a very different situation. Young people were especially vulnerable to that virus. More young people died than older people, particularly in the military, as they were coming toward the end of the war and being transported across Europe and back to the United States. They brought this disease all over the world, and they brought it back here. And it was devastating for young people and for children. Devastating. It was not uncommon for people to get this virus and be dead in 3 days. Now, it wasn't Ebola and it wasn't the bubonic plague, but it was bad. Not at all like COVID-19. Not at all. We're not even apples and apples here. We're barely apples and oranges if you read the history. Well, let me take you to pages 456 and 457, because part of the narrative that we've been sold, and now we're being sold again, now we are being criminalized. All right. If you walk out of your home and you're in downtown Franklin, Tennessee, in the heart of conservative Southern America, and you don't have a mask on, you can go to jail for a year. Be fined $2,500. I didn't make that up. Williamson County mayor did that. 6 of the city mayors went along with it. Let me read you what John M. Barry said, a couple of lessons that they learned. Here's what they learned from 1918. One tool of no use in regards to a pandemic that they learned from 1918, one tool of no use is widespread quarantine. It doesn't work. They found that out in 1918. On page 457, Barry writes, surgical masks are next to useless, except in very limited circumstances, chiefly in the home. What did they learn? And in case you're wondering, it's not like surgical masks are radically different today than they were from 1918. And I can make darn sure that when he said surgical masks, he was very well aware of the idea that you could make up a mask from paper towel and duct tape. He's saying surgical. Been there, done that. It didn't work. Evidently, Governor DeWine didn't quite get to the end of the book. Because now he's basically saying, if you get up my coloring scale to red, you're going to jail if you don't wear a mask. Well, this isn't the Spanish flu. Why? It didn't work then. Well, why would we do it now? Why? Mm-hmm. Because the governors think they can stop people from getting sick. I don't know. Do you think many people wake up in the morning and say, I got an idea, let's get sick today? That's exactly what I want to do. I want to go get sick. That's my goal. Furthermore, and I'm not suggesting we give out COVID popsicles, but there is a clear reality about herd immunity. The number of people who get this disease, overcome this disease, have antibodies, and in essence are self-inoculated from this disease, reduce the ability of the disease to survive in culture. They become a barrier against the spread and a protection for those who are most elderly and most vulnerable. I'm not saying we should celebrate anybody getting sick, but this disease is so mild that the people who get sick and recover, many never even knew they had it. This is real. So let's go to Trumbull County real quickly, and then Rob, I'll come back to you. Trumbull County was one of the red counties that were branded in Ohio by the governor as a hotspot. Well, Trumbull County is the county where Dr. Chuck McGowan, our good friend, from COVID Chronicle #1 on the public square, he's been in service there. Chuck's in his 80s. He helped supervise 8 clinics that primarily deal with patients that receive their medical care through Medicaid. Chuck McGowan was the first doctor in Trumbull County to go into self-quarantine for COVID-19 because the first patient that was positive in Trumbull County came through Chuck McGowan's office. So when his county was suddenly turned red, Chuck started asking some questions, and he got back to me with some of the results. Now, Chuck couldn't join us tonight, but I want to tell you what he found out. He found out that the cases in Trumbull County are not skyrocketing, as the governor intimates. He went around and talked to lots of people. He talked to a number of other healthcare facilities. He had one number, I think he gave me a number of 180 tests were done in, I think, a 2-day period. Of the tests that have come back so far, they're still waiting on some to come back. 157 out of 180 have been negative. Then a local media personality went around to the major hospitals, the 2 major hospitals in Trumbull County, and said, are we a red county? I mean, what's going on? The spokespeople for the hospitals responded saying, there's nothing going on here. This is business as usual. We're not in any accelerated state. But the governor and his team looked at a few numbers and said, that's a red spot, slap a mask on, or go to jail, or be penalized. Rob, talk to us about Butler County and the sheriff there.
Butler County, the sheriff came out and said law enforcement there is busy enough. They have enough issues and problems to deal with. They weren't going to be the mask police. So everyone thought naturally the health department would be the ones for enforcement. And the health department says, we have enough going on. We can't be out there being the mask police, telling everyone you must have a mask and where you must wear a mask. They're looking at it on the front lines and they think it's ridiculous. And that's how they've responded, or why they've responded the way they have. And when it comes to masks, Dave, that's one of the questions that we get most often is from a legal standpoint and a legal perspective. Does the governor, does the director of the Department of Health have this authority to issue a mask mandate for communities around the state of Ohio? Is there a lawsuit, litigation, anything that can be done regarding that?
Well, we've got 6 bills, 6 portions of bills moving through the Ohio General Assembly. And for those people that are listening that are connected to legislatures in Florida or Tennessee or Ohio or Illinois, this has got to be a remedy ultimately for the legislature. The courts are not going to get this right, even though we've got friends that are involved in 4 different pieces of legislation where they have begun to be successful against governors and these orders, because the courts look at these emergency orders and say, wait a minute, you can't have an emergency forever. Where's the emergency? Where's the hurricane? Where's the earthquake? Where's the forest fires? Where did the disaster you predicted in model after model after model, where is it? And so you can't do this forever. So, and the other thing, of course, is you can't make up executive orders and then turn around and jail people for that. I mean, this is not a dictatorship, but it's being run that way. So, but the problem is, Rob, is people have to stand up and challenge.
They do. And the ones that have been challenged in court from a business perspective have all been victorious thus far. When you look at the gyms case in the state of Ohio, when you look at business owners in Florida and North Carolina that were shut down or taken to jail even for operating illegally, when an order was put out, they've all been vindicated, because what law enforcement was trying to do, or what those orders were trying to do, was just tackle that short-term problem. They knew constitutionally that they didn't have a case and it would not stand up in the court of law. But we do need to change legislation in a number of states to make this, if we go through this again, so that we won't have to go through this nightmare of a scenario.
And why are we doing another COVID Chronicle? And we expect that the numbers of people that will stick with this story will diminish, because people run out of patience, they run out of time, and they just don't want to stick with something. I understand that. I don't blame. I'm not happy about still having to do this stuff. But if we don't fix this problem with governors and municipal mayors and county mayors acting outside the authority of the rule of law, this will not end. This will not end. If they can get away doing this now, they'll be back and do it again and again and again and again. Let me tell you, when it gets to contact tracing, that's a whole nother nightmare that's coming in the name of this emergency, with the loss of privacy, civil liberties, and additional criminal questions. The question of vaccines. Are they going to get to the place where, in the name of an emergency, they're saying, you take it or else? And constantly, in a very passive-aggressive methodology, these governors have said, oh, we didn't close that, or oh, we didn't do that, or oh, we would never force you to do that. But if you don't, then we're going to do the following. Listen, this isn't right. Melanie, go ahead.
Well, there's a time crunch now because school's starting and parents are panicking because they want their children back in school. There really isn't any reason to not put children back in school, since they are not the vulnerable population. Teachers, though, are saying what if we were at risk? What if we were the ones who catch the disease? Just for those who are listening, my solution to that is schools should put everyone back 5 days a week in the classroom, business as usual. If a parent is concerned, allow that child to do distance learning. If a teacher is of a concern for their own health, let that teacher be the one who teaches the distance learning. Assign the teachers who have concerns to the distance learning. Let the teachers and let everybody else just come in and learn as usual.
Melanie, you're a former school teacher,
Mm-hmm.
and everybody knows that school teachers and medical practitioners and nurses and doctors, look, when you're around kids in flu season, you're going to get and catch everything that there is to catch. People that work in beauty salons, people that work in barbershops, when you deal with it constantly, when you are dealing with people all the time, when people get sick, you get sick. It goes with the territory. Again, if this was Ebola or the bubonic plague,
Mm-hmm.
it'd be a whole different conversation. Yeah. We'd be 1,000% for full distance learning. Nobody wants to see anybody get sick and die. But how do you keep people from getting sick?
And Dave, the sad part is the control of this, the management of this disease parameters through the governor's offices. They are not only fudging the numbers on the case counts, but they, like the parameters for being called a red county in Ohio, if you don't test enough, that is an indicator. If you don't have enough positive cases, then that's an indicator. So there's no win. If the testing numbers go down, if the positive case numbers go down, what you would expect it to do, that must be a flag because we must not be testing enough people. So therefore, that's an indicator that can bump you into, and they're fudging the death certificates as well in the same way.
Well, that's one of the questions that came in. Someone asked, is it more than politics that prevents keeping the public informed to the declining death statistics? The number of deaths continue to decline, but it doesn't seem like that's getting out there and people are talking about
Well,
that.
The CDC has revamped how they can do the death counts on this disease, and you don't have to have a COVID direct cause of death. The example that was used in the Texas Collin County discussion was someone dies of leukemia, but prior to death, they had a cough. They didn't even have to be tested for COVID. If COVID could have been a factor, they will list COVID on the death certificate.
Now,
it's shameful.
Let me share a very good grid of reality that every one of us can use to help when we get in these conversations and people roll their eyes because they spend too much time watching cable news. There's a site called Statista, S-T-A, this is a test, S-T-A-T-I-S-T-A, Statista. It is a data corporation that provides surveys, graphs, all kinds of analytics to American industry. And they have some free information that is consistently available. And if you go to statista.com and look for COVID death rates per 100,000, which is a critical indicator on what's happening, per 100,000 people, how many are dying from COVID? Even with the inflated numbers and the inaccuracies, you get a picture that is quite remarkable. You learn things like in Ohio, 25 people out of 100,000 die of COVID. But then you dig a little deeper on the facts that you get from the American Policy Roundtable and from Rob and Melanie's research, and what you discover is half of those are in long-term nursing care facilities or prisons. In essence, they're already a quarantine community. So the death per 100,000 in Ohio is much closer to 12. In Tennessee, it's 9. It's exceptionally low in Florida. It's skyrocketed in New York and New Jersey because those communities did not protect the most vulnerable, and they actually helped to infect people in nursing care and long-term care facilities. So when you look at the death rates per 100,000, you find out that this is a very mild disease with mild symptoms for most people. We're not making light. Many of the friends listening right now are older. Many have comorbidities. Please, friends, be careful. This is nothing to toy with. But look, the truth is the truth. You got to put the entire thing in perspective. When we start throwing people in jail for not wearing a mask, they're 30 years old and healthy as an ox, and you say to that person, you got to wear a mask. And oh, by the way, if you're running and you're running with someone nearby, or you're biking and you're passing bikers, there's bikers all around, you got to wear a mask. I was at a golf course and I saw that this is giant putting practice area. Sign says no more than 4 people in the practice area. You could put 40 people in that area and they couldn't get within 10 feet of each other. 4 people? Okay.
I heard a story.
Other questions, Rob?
Well, I get to the question. I did hear a story today of someone that was refused service for not having a mask going through the drive-thru. They were refused service because they did not have a mask.
One of our staff members was humiliated in a medical office because as they went to the reception area, they didn't have their mask exactly properly installed. And
well,
humiliated to the point of tears.
Question. What do we do as business owners if they begin shutting businesses down again? How do we, the people, respond? Do we protest? Do we stay open?
Okay, number one, let's talk about that. Thank you. That's a very good question. We would always recommend our friends in the business community get the best legal advice and follow the lawyers and those that you trust. Now, here's a scenario to consider. If the Department of Health or state officials attempt to shut down a business, what's the basis of shutting it down? First off, I'm very used to wearing masks because in the company that I came from, the small family metals company we're in, we all wore masks all the time. So the idea that there are masks that you wear in certain kinds of businesses or in medical settings, no big deal. If there's a mask mandate and you feel that it is inappropriate that your company has to wear masks in that situation, you've got to fight. You've got to challenge. Mm-hmm. You got to get a lawyer who's willing to say that they'll represent you and defend you because you don't need a mask based upon the practices you've had for the last 4 or 5 months where you have 0 infections. There's no threat here of an infection. There's nothing here that's any different from the time when the governor said, I didn't have to wear a mask. So it's the burden of the state to prove why you must. And just because they say so isn't sufficient in a court of law. Now, the other thing people are saying is, well, I'm afraid I'll get sued. That's a reasonable expectation and an understanding. But look, friends, judges have better things to do than to clog up their courtrooms with COVID cases that are completely illegitimate. Afraid to get sued of what? Well, I'm afraid if somebody gets COVID in my shop, they'll sue me because they'll say they got it at work. At which point in time we'll say, prove it. Prove that you got this virus at work. Prove it.
Right.
Now, of course, the person has to be well enough to survive the length of time of the lawsuit. So by the time they get to court, they will have had the disease and gotten over it. So what compensation would be absolutely necessary because you got the flu at work and got better? Does that mean that you can get sued for the common cold at work? But here's the other point in regards to all of this litigation. How will a single plaintiff ever be able to prove the exact time, place, and circumstances by which they got the disease in your shop, in your company? Because on cross-examination, any decent lawyer will say, well, if you knew all those risks and you knew that moment would create that disease, why did you do that? Why wouldn't you have practiced appropriate social distancing? Isn't it your responsibility to prevent that from happening by being in the right space at the right time? So if you have a protocol and you have a consistent ethic and you have a track record, your position is highly defensible. And just like you can't run away from a virus, you can't run away from people that might be in your employment right now who have nefarious intentions. There will be lawsuits, but it won't be long before plaintiffs are thrown out rapidly and cases are thrown out because judges aren't interested in cases that have no merit. Go ahead, Rob, another question.
Well, I just wanted to add, we're getting a lot of questions regarding lawsuits to stop the governor's orders in each of the respective states. And we always stress and highlight, yes, that's possible. However, we need to change the laws in those states. We need to work hard to make sure that those orders can't be handed down by dictate. You can't create one dictator in a state that is allowed to do these things so they can try and defend it in the court of law.
But we also have constitutional protections. The lawsuits are based on state statutes, and whether those state statutes provide the appropriate constitutional protections. They can't take property without due process. They can't deny someone their liberty, i.e. go to jail if you don't wear a mask. federal constitution and state constitutions say you can't have excessive fines. So those are all challengeable, but someone has to make the challenge. Someone has to step up to the plate
Now,
and go through the process.
it's not hopeless. In Ohio, the 1851 Constitution Center has got at least 4 suits, and there are 2 other law firms that have suits as well. We're talking about bridal shops, restaurants, gyms, Cedar Point and Cedar Fair. For those of you that are listening in California, whether it's from Knott's Berry Farm to the several Kings Island, Cedar Point, there are a number of amusement parks that Cedar Fair owns as an LLC, and they have sued in Ohio based upon the fact that they just opened today. So what's going on in the governor's picking winners and losers. So you can sue in state court, you can sue in federal court, but litigation is legitimate and it is important. Now you need a good plaintiff. You need someone that has a case. So that's important. And if you want more help on that, please get a hold of Melanie and Rob at our shop, 1-800-522-VOTE. You probably can leave a message with a specific interest, and we'll try to help you find people that can sue on your behalf. And if you know good lawyers that do pro bono work or that would be willing to take a shot at something like this because they care for the future as well, these cases are not massively complicated. Mm-hmm. We're seeing significant success. We'd hope to get enough of a bonfire, if you will, burning in Ohio with enough cases going up, and we've already won a couple of those cases. Our friends have won them, that it would inspire others around the nation. We're getting close, but we could use more people stepping up and doing that as well. Rob, another question.
Well, we had someone write in that's watching, and these circumstances can be so sad because talking about the limit of gatherings, we have someone who had a family member die unexpectedly, and they weren't able to have a funeral service because of the order that was handed down. The funeral home didn't want to risk having too many people in a room, and those stories have been heartbreaking throughout the state. When you look and see it, some groups that are permitted to gather, and then others that cannot, to allow it to happen the way it has. It just breaks your heart to think of the things that have happened over the last 4.5 months.
Time and time again, and yet today in a news conference, the governor of the state of Ohio said they have never shut down anything as it relates to religious practice or religious liberty. No, they just said it's illegal to get together with more than 10 people. And they're saying right now, if you're in one of the hot counties, and how many did it go up to today, Rob, in Ohio?
I think 11. He dropped 1 or 12 and dropped 1. Huron dropped.
Yeah, we have 12 now.
Yeah.
So 12 counties, you have to wear a mask in church, according to the edicts of the state.
Not constitutional.
No, it's not.
Well,
it's ridiculous.
You know what? And you know what? If I'm not mistaken, the Attorney General in the state of Ohio, Dave Yost, was tweeting over the weekend regarding California not permitting singing in church. And he was tweeting how that was unconstitutional and no one could tell him what to do in that regard. And then today, the governor of the state of Ohio issues a mandate, issues an order that you have to wear a mask in church.
This cannot go on much longer. Here's kind of the good news to it. Is the reality of the science of the virus is if we're careful, by the mercies of God, if we're careful and disciplined, this virus is actually chugging along quite well in the sense of people overcoming it in the way that humans have to overcome a virus. In many ways, this has been a very gentle malady, but what has happened is it has shown spotlights upon the cracks in our foundations and upon the willingness of Democrats and Republicans alike in power to suddenly blow up into these COVID dictators and begin to attempt to control people for all kinds of reasons in panic and hysteria. Now, let's go back to the question of why for just a moment. There is, well, before I do that, Rob, because we're getting ready to close here, and any other questions that we want to get to real quickly? I don't want to shut them out.
Someone says, is this all political? Will the virus go away in November?
Okay, though that takes us right to where we want to go. My guess would be, yep, it sure will, if the people who want hysteria to rule get what they're looking for. I wish this wasn't true. Some of the most non-political people that I know have contacted me this week and said, this is about the presidential election, isn't it? Now, I'm not going to answer that question with an affirmation from the American Policy Roundtable because we are a nonpartisan organization. And please don't groan out loud. But it doesn't do us any good to jump on a Republican bandwagon or a Democratic bandwagon, because our goal is to try at all times to tell people the truth regardless of which party benefits. But there is no question whatsoever COVID is going to be a part of this election. And there is no question that there are people in public office, and particularly in the media, who are rooting for the virus because their hope is that chaos and discouragement will cause people to vote for certain types of candidates. And chaos and confusion and frustration will cause them to vote against others. Yes, this will be a part of the election. Yes, there is a political edge in all of this. Now, as a nonpartisan organization, we're not going to fill in the blanks any farther than that. Stay tuned. There'll be more to talk about. Rob, if we've got no more questions, let me just come up and wrap up real quickly here. Melanie, thanks for joining us tonight. Anything you want to add? I never want to get a final word in, but if you've got one first.
I just don't want people to be discouraged. We are not driven by fear. Scripture teaches us that we have to come from a perspective of having love, power, and a sound mind. We have to use our minds. We have to stay focused on strategies, and we have to not cease in praying for the end results. Praying for those who do get sick, praying for the eyes of the hearts of people to be enlightened so that they see all of this from God's perspective. We don't have to walk around in discouragement. We just have to stay focused and take the next steps each day.
Yes. Well, let me conclude where Governor DeWine started in the book. And again, the Ohio strategy has been so often cited and duplicated. Let me go back to John M. Barry's lessons learned from 1918, a far more deadly crisis than COVID-19 even remotely looks like at this stage, so far into this pandemic. So the problems, Barry says, presented by a pandemic are obviously immense, but the biggest problem lies in the relationship between governments and the truth. He goes on, risk communication implies managing the truth. You don't manage the truth, you tell the truth. And he concludes his book with these words: those in authority must retain the public's trust. The way to do that is to distort nothing, to put the best face on nothing, to try to manipulate no one. Lincoln said that first and best. A leader must make whatever horror exists concrete. Only then will people be able to break it apart. And that's the spirit in which we submit these times that we share together with great hope. We have not been given a spirit of fear, but of love, power, and a sound mind. And I pray that you'll be able to use this piece, this COVID Chronicle, and the whole series and everything we're doing on the public square as a means of sharing with others so they recognize this isn't just about politics. It's not just about an election. It's about the health of a government where we can treat one another with the respect and the open-handedness to believe that we're telling each other the whole truth and nothing but the truth. So help us God. Thanks for joining us tonight. Please join us and stay with us every day on the public square. Thanks, Rob. Thanks, Alan. Thanks, Melanie. Thank you, Anna, and all the team. We'll see you again soon. Good night.